Hi, everyone. Our group had the topic of breastfeeding promotion, and we're going to go through our presentation today. Our group is comprised of Kelvin Dam, Ileana Rodriguez, and Cassandra Smith.
Just to give a general background, breastfeeding is the act of feeding breast milk to an infant. Breast milk contains calories, vitamins, minerals, and other important nutrients that help an infant grow and develop. It is also to be found for individual children ages 2 to 23 months. It can provide half or more of a child's energy needs between the ages of 6 and 12 months, and one-third of the energy needs between 12 and 24 months. Looking at breastfeeding, it has both pros and cons. To start with, breastfeeding is good for your health. Women who breastfeed tend to recover from childbirth faster than women who choose not to nurse their babies. Breastfeeding may reduce your risk of ovarian and breast cancer. It may also decrease your chances of developing rheumatoid arthritis, diabetes, hypertension, and cardiovascular diseases as you age. Breastfeeding is convenient. Your breasts are the perfect way to supply your baby with optional. If you exclusively nurse your baby, you will not need to buy formula, bottles, and supplies. Breastfeeding has also been found to delay your period and serve as natural birth control. Breastfeeding can prevent your period from returning for 3 to 6 months or even longer. Typically, menstruation returns approximately 1 month after you stop breastfeeding exclusively. And looking at some of the cons to breastfeeding, you have less freedom. It can be exhausting, especially during the first few weeks when you will be breastfeeding your baby every 2 to 3 hours around the clock. Breastfeeding can be painful. You may have to deal with some of the uncomforts or even painful problems coming to breastfeeding. These include things like breast engorgement, blisters, plugged milk duct, and sore nipples. It can be stressful if you are modest or embarrassed. Some women may be uncomfortable and embarrassed about breastfeeding around others in public. Breastfeeding can also be difficult in the beginning. Not every baby latches on immediately or breastfed well, but there are considerable statistics for breastfeeding. It has been found about 44% of infants 0 to 6 years old are exclusively breastfed. Few children receive nutritional adequacy and safe complementary foods. In many countries, less than a fourth of infants 6 to 23 months of age meet the criteria of dietary diversity and feeding frequency that are appropriate for their age. Over 820,000 children lives could be saved every year among children under 5 if all children 0 to 23 months were optimal breastfed. In this particular slide, you can see the statistic of various countries. As an example, Bangladesh shows that 64% are breastfed in comparison to the United States of only 19% and even lower in UK. Now we will move on to the campaigns.
Hi, my name is Ileana, and I am going to be covering the POUR campaign for our project. So for our POUR campaign, we selected a campaign that took place in Mexico City, Mexico in May of 2014. This campaign specifically utilized posters throughout Mexico City that featured either popular actresses or a famous boxer throughout the city on giant billboards. Billboards showed women topless with a strategically placed banner across their chest that says, "Don't give them your back, give them your breast." And in the top left corner, it had a benefit of breastfeeding. So in these cases, I'll just translate these very quickly. It says, breastfeeding is the right of your baby and yours as well. It says, maternal milk is the best vaccine for the defenses of your baby. And breastfeeding protects your baby against illnesses like diabetes, obesity, and heart attack. So this campaign was not received well by the general public in Mexico City, and there were many activists for breastfeeding that spoke out against it because of the perception that it gave around breastfeeding. So this campaign originally targeted people who breastfeed in Mexico City and really anyone who was going to see this billboard. Mexico City has very low rates of breastfeeding. It's the lowest in Latin America, with only 14% of women reporting that they breastfeed. And so the backlash around this was really specific to the sexualization of breastfeeding and the perpetuation of very harmful stereotypes and views around breastfeeding. And one of the activists of a reproductive rights group actually called out in a news article, it's not only a very terrible campaign in terms of how it looks, but it's also the message that if you don't breastfeed, you're a bad mother and you are the one to blame. And this person, Regina Thames, is referring to the part where it says, don't give the baby your back, give them your breast, which really does imply that you would be turning your back on your baby if you do not breastfeed. There are different barriers to breastfeeding, one of which is this quote here. So poverty and poor nutrition top the list, but also more women than ever have entered the workforce. Hours are long, which makes breastfeeding during the day challenging, while pumping milk at work is not encouraged and in many cases prohibited. So knowing that, we went into the theory that was used potentially to create this campaign. So really, theory of planned behavior was the one that fit the best. So attitude, subjective norms, and perceived behavioral control. So it tried to shift the attitude by using models to appeal to both men and women. It provided a benefit of breastfeeding. It did try to sway public attitude, so the subjective norm around it, even though it was very unsuccessful in the way that they did it. And then perceived behavioral control, they do call out that breastfeeding is your right, and your baby's right. So trying to put that control in the hands of the person who's going to breastfeed. One study looked at all of the different media campaigns within Mexico City and found that there was insufficient political will of health officials, that the monitoring of policy and code is in the hands of the industry or the employer, that there's an insufficient budget for the protection and promotion of breastfeeding, and that breastfeeding campaigns are really elaborated by companies that produce breast milk substitutes, so formula. So multiple streams theory might be a little bit more helpful here, because it would utilize strengthening the promotion of breastfeeding through politics, understanding the problems of having formula makers be the ones really prevalent in the media, and reducing that. With politics, it would require promoting or electing politicians who support breastfeeding campaigns and who are going to put budget towards that. And then also enforcing policies. So enforcing the availability of breastfeeding rooms in the workplace, increasing maternity leave, and being able to overcome those barriers that were identified. And with that, that's our PUR campaign, and I will turn it over to our average campaign.
The average campaign is the Not Sorry Moms campaign. It's a Northern Ireland breastfeeding campaign that was established in April of 2009 as part of the reform to health and social care in Northern Ireland. The major regional organization for health promotion and health and social well-being improvement. Their role is committed to addressing the causes and associated inequities of preventable ill health and lack of well-being. They are multidisciplinary, multi-professional body with a strong regional and local presence. They address some benefits and addresses the stigma barriers for women facing breastfeeding in public. At first, the purpose of this is to improve the health and well-being of mothers and babies in Northern Ireland. In this particular campaign, the focus was to support moms who want to breastfeed in public and to increase awareness to the health benefits of the breastfeeding. It was supported to provide a supportive environment for breastfeeding, promote the health of breastfeeding, and contribute to increasing breastfeeding rates in Ireland. Breastfeeding reduces the focus was them to indicate how breastfeeding reduces a baby's risk of serious stomach and chest infection and there's nothing to apologize for. They also indicate that supporting a breastfeeding campaign aimed to support mom to breastfeed in public and promote the health of the breastfeeding. There have been numerous models of health behavior that showed affected individuals should not be the sole target of health promotion because of the attitudes and behavior of those around them affect their decision. And this is essentially the case in breastfeeding, where the mothers feel supported by those around them are more likely to initiate and continue breastfeeding. But this was not the case where this I would say an older mother is constantly in various situations in public. She's constantly apologizing, and that's the gist of the mom campaign saying sorry. The health belief theory suggesting the individuals keep healthy behavior and prevent disease and health problem if they believe that they are susceptible to the problem, if they believe in the severity of the problem, if they perceive the benefit of an action and good outcome related to their health. And according to this theory, the health belief model, a mother who believes that there are benefits of breastfeeding for her infant is more likely to actually breastfeed. And then looking at the theory of planned behavior. So the level of social pressure that mother feel from others, subjective norm, as well as the benefits of breastfeeding. And with the health belief again, the health belief of both the mother and the child, the perceived benefit, reduction of the risk of baby's serious stomach and chest infection, as well as reduction of mother's risk of breast and ovarian cancer, and with the modified factor of the age of the mother, where she was a little older than what is typically seen. Research has shown that breastfeeding in public is a controversial issue, as well as breastfeeding being found to be embarrassing in public, which is an influencing factor in a woman's infant feeding decision. Decisions about infant feeding are embedded and are continuously being made within a woman's social and cultural context. And one of the challenges of facing women in maintaining breastfeeding is the social stigma associated with breastfeeding in public. It's well documented, as well mainstream media, that there are consistent reports on incidents where a woman have been told that they cannot breastfeed in cafes, shop, galleries, swimming pools, or in a parliamentary. That is the gist and the focus of this campaign. Sorry. Next, we'll move to our excellent campaign.
Hello, everyone. This is Kelvin. For campaign 3, we rated a health promotion campaign called the Philly Loves Breastfeeding as excellent, and I'll discuss more on the next slide. This campaign was conducted by the Philadelphia Department of Public Health to promote breastfeeding, especially among women of color. So according to some of their own statistics, Black infants had higher mortality rate of 2 times compared to white infants, which is something that can be found similarly nationwide. Some of the benefits were previously outlined. The city just wanted to perform a health intervention that involves promotional materials to destigmatize the practice of breastfeeding for mothers, families, employers, and the public. So the promotion materials involve printed materials, billboards displaying positive images of Black women and other minority groups breastfeeding their babies and conveying normalcy involving the activity of breastfeeding. Social norms theories examines the influence of perceived social norms on an individual's intentions to engage in a specific behavior, which is breastfeeding. So according to social norms theory, individuals are motivated to conform to societal norms, either through gaining approval, avoiding disapproval, maintaining a sense of belonging. So these norms can be descriptive, which are perceptions of what others commonly do, or injunctive, which is perceptions on what others approve or disapprove. So as we progress through this model, we see intentions, which represents an individual's readiness or willingness to perform breastfeeding or exclusive breastfeeding in this example, and they serve as key predictors of future behavior involving the constructs of attitudes, subjective norms, and perceived behavioral control. From the billboard and promotional material campaign, the goal was to enhance the intentions among African American and minority women in Philadelphia, pertaining to the social norms theory, promoting the activities of breastfeeding among women to conform to these breastfeeding behavior, highlighting the community support for breastfeeding, where individuals within this target population can feel positive reinforcement, or the messaging of feeding your baby is normal, to conform to this breastfeeding behavior, and then cultivating a positive social identity associated with some of the minority women and breastfeeding behavior as positive social images, and then showcasing the examples of positive role models, other African American women and minority populations who were perhaps successful in breastfeeding their infants. Just in consideration of previous health promotion efforts and other theories that we examined, we think for the intervention, theory of planned behavior is best applied to a health campaign involving breastfeeding promotion. We think the ideal campaign should focus on increasing the intention of breastfeeding by addressing any misconception or myths, providing evidence-based information, and then highlighting the positive experiences of breastfeeding mothers. We think this would foster strong intentions, and the campaign can ultimately lead to increased breastfeeding rates. And then it would be helpful to tailor these messages or interventions to any specific needs of the community, and receive ongoing feedback for adjusting the intervention. And to talk a little bit more about the constructs and support from literature, attitudes, this is a construct that's more or less considering a person's positive or negative evaluation of breastfeeding. And we think the ideal campaign would be successful through enhancing education and awareness of the numerous benefits that Cassandra highlighted pertaining to breastfeeding for both mother and the baby. Some of them that was mentioned were improving the immune system, bonding, long-term health benefits. And as a predictor, Jefferson significantly associated knowing someone that breastfed an infant and being breastfed as an infant among college-educated Black women. For subjective norms, we understood that shaping subjective norms was important and spans across some of the other theories discussed. It's important in providing accurate information, emotional support, positive role modeling, and this is supported by a study from suggesting that families and friends were valued highly among non-Hispanic African American mothers, and family members and the immediate social network of breastfeeding mothers in counseling sessions, education sessions were found to be effective in maintaining familiar support through the duration of breastfeeding. And lastly, perceived behavioral control. We think we can better empower Black women, Black mothers, to increase their confidence in their ability to breastfeed successfully. And we can do this by providing practical information, resources to address these concerns, such as breastfeeding classes, support groups, lactation consultants, and workplace accommodation. And Safon et al. Suggests education is needed in addressing social constraints among the economically disadvantaged women who are pregnant.